Common causes of mental disorders. There are multiple factors that usually come together to cause for mental disorders. It is not usually a single cause, but mostly a complex interplay of multiple factors that come together to lead to mental disorders. Here are 6 common causes or factors that lead to mental disorders. Number 1 is biological factors. The biological factors include genetics or inheritance. This is because there are some disorders that run in family, meaning they are genetically inclined. They can be transmitted from one person to another through inheritance. Or on the other way around, we can say that a person who is having history of mental disorders in the family is more likely also to develop mental disorders when some other factors come in. Then we have neurological or neurochemical factors. These neurochemical factors include imbalance in the neurochemical substances in the body, that is the neurotransmitters such as serotonin, dopamine, and norepinephrine, which usually help in communicating or sending impulses within the nervous system, communicating from one part of the nervous system to another. So when there are imbalance, when they are excessively high or when they are deficient, they can lead to mental disorders. Also, brain injury under the biological factors. Brain injury, structural injuries to the brain as a result of trauma, as a result of accident. When one's brain is affected structurally, it can lead to changes that later on lead to mental disorders. Likewise, some other abnormalities of the brain itself. Chronic illnesses such as epilepsy, conditions such as stroke, conditions such as multiple sclerosis, they usually lead to mental disorders because they affect the nervous system. Substance abuse are another things under the biological factors. People who are exposed to drugs, substance abuse, these are among the common cause of mental disorders. Many mental disorders now, you see that they have a relationship with drug abuse. Number 2, psychological factors. These psychological factors include trauma. Trauma here, we are talking about being exposed to trauma, especially from childhood or in some significant aspect of person's life. This trauma include child abuse. When a child is abused, usually they develop psychological stresses that can lead to mental disorders later on. Or neglect, when there is a neglect, a child is neglected, no good care, no good parenting, they can lead to that. Or witnessing some violences in life. When someone witnesses multiple violences, these ones can have lasting effect in his memory and can later on lead to mental disorders. Still under the psychological, we have stress. Stress, prolonged exposure to high level of stress can contribute to disorders such as anxiety and depression. Negative thought patterns, when someone is having negative thought patterns, when someone is persistently pessimistic, or when one is having self-critical thoughts, may usually increase to one's vulnerability to mental disorders such as depression. Then also, personality traits. There are some personality traits that have a relationship with mental disorders. Some mental disorders have their basis or their genesis from the personality of an individual. This includes certain personality types like those people who are prone to perfectionism, people who like to always need perfect, always present themselves as perfect. They don't want flaws, they don't want mistakes, they always need to be perfect. That trying to be perfect, when they do something that portray them as imperfect, they become self-disturbed, and that can lead to overthinking, lead to problems with the thought of the person, and mental disorders. Likewise, people with impulsive personality, having repeated thought, repeated actions, they can lead to conditions like obsessive compulsive disorders. Factor number 3 is environmental factor. These environmental factors include social isolation and loneliness. When someone is exposed to a situation that leads him to social isolation and loneliness, an idle mind is always a devil's workshop. That will lead to disturbance in the thought process of the person, disturbance in the psychology of the person, and can lead to mental or can make person prone to development of mental disorders. Poverty or financial stresses are among the environmental factors. Poverty. When there is too much economic instability, it can exacerbate mental disorders. Unsuitable home environment, when the home environment where somebody is raised is unsuitable, such as home that is filled with domestic violence, domestic conflict, there is lack of safety at home, they can contribute to mental disorders. Workplace stress, where somebody is working, where you are working or in your business area, if there are some stress, too much stress in the workplace, it can also contribute to one developing mental disorder. Then also exposure to violence or disaster, when one is exposed to violence such as rape, such as banditry, such as war, and all those things that are violent in nature, it can lead to conditions such as post-traumatic stress disorder, PTSD. Number 4, developmental factors. Developmental factors has to do with factors that affect a person through his development process in life. This can include prenatal and early life factors. Prenatal, things that happen or that affect the person even before the person is born. When the person, let's say, when the mother is pregnant and that mother is not healthy, meaning the maternal health is affected, it can affect the child. The drug the mother takes, if the mother is taking cigarette, if the mother is taking alcohol, if the mother is exposed to so many reckless behaviors or attitude that some of them can lead to or can affect the unborn baby, or some situations that the person is exposed to at early life, as well as adverse childhood experiences, neglect, abuse, prenatal loss during childhood, increased mental health risk. Factor number 5 is socio-cultural factors. These socio-cultural factors can affect the person's mental health status and can lead to mental disorders, and this includes discrimination and stigma. When someone is exposed to stigma as a result of either inability to cope up with cultural needs, or as a result of anything that is that does not conform with the societal norms, those things can expose somebody to stress. Stigma as well, maybe as a result of something that someone has done or someone is having, or where the person is coming from. This discrimination and stigma can cause social isolation, withdrawal from family and friends and the society, and can affect the person's mental health and can lead to mental disorders. Cultural pressure, when there are expectations from the person culturally, and these expectations become a fundamental part of life and one is not able to meet up with them. This continuous pressure onto the person can push someone to the border and even cross the border to move to or to lead to mental health issues. Economic stress, very, very common. Poverty is part of, or is one of the commonest factor that exacerbate mental health. Number 6, lifestyle factors. There are some lifestyle factors such as the sleep deprivation, when someone is not having adequate sleep, maybe as a result of working late at night or having less rest in an effort to make needs or meet up with the needs of life, or to achieve some certain goals, or to meet up with some task, or whatever is depriving somebody from having enough sleep and rest. It is affecting the brain and can exacerbate or lead to mental disorders. Poor nutrition, when one is not eating adequate diet, when the person is not eating the right food to eat, when someone is having deficiency, because brain is dependent on continuous supply of glucose and oxygen. Likewise, our whole body is dependent on continuous supply of nutrients and oxygen. If these nutrients are not provided, are not adequate in the person's body, they can lead to one, having issues including mental health issues. Likewise, sedentary lifestyle, running a lifestyle, no exercise, no too much work, eat, sleep, rest, eat, sleep, rest. You are not exposing yourself to something that improve your physical health, that can lead to mental issues. Remember that physical health and mental health are always also going together. There are, however, some other factors such as age-related factors, because some mental disorders are related to the age. When someone is aging, when someone is becoming old, sometimes some degenerative changes can lead to development of mental disorders, or some hormonal imbalances. Some hormonal imbalances can cause personality changes that, if not controlled in time, when they persist, they can lead to mental disorders. These are just 6 among other causes of mental disorders.